because the more your patient has big breasts in and hold them, the more air gets in the stomach, and that's going to include that pancreatic tail. So we'll start with panc, and then we'll go to common bile duct and gallbladder, which you guys have probably seen go by quite a bit. I usually do my CBD right after I do my main portal vein because my depth is appropriate. I'm looking in that neighborhood where my measurement of main portal vein is. So it's just the same neighborhood. So I just do MPV with calipers and then immediately do my CBD. Gallbladder, you're going to see go by, and we're going to evaluate him in two planes. Why do we do two positions? Why do we do that? To check mobility, and then see if anybody's kind of rolling around and kind of rolling out of the neck. So we're going to do both a supine and an LLD. So I usually do all my liver stuff, and then I do my gallbladder in supine, roll my patient, do my gallbladder in LLD, and then that sets me up for my kidney scanning. So I have 180 degrees to scan my kidneys. So we'll get into that with renal scanning here in a few weeks. And are you awake? Wait. CBDs, ideally, we want to show them extended from the distal portion at the head of the pancreas all the way to the common hepatic if we can. You guys are just going to worry about finding a little piece that looks like CBD. And how do we prove that it's CBD and not hepatic artery? With color. You got it. Smart. It's almost like you've been studying. Come on, really? I thought you were going to. So we saw the pancreas go by when we were doing left liver lobe. And we also know that there's this big chunk of duodenum that sits right anterior to it, correct? So sometimes we might have to come up, kind of like we did for that main portal vein. So instead of being right on top of it, we might need to come up to that left liver lobe and angle through that left liver lobe to find it. Other times we might have to go below that duodenum. Now our main portal vein, we scanned at about 10 o'clock. It's going from the mesentery over to the liver. Our pancreas is going to be the opposite. He likes about 7 o'clock. So we're going to kind of find that portal splenic confluence. And what's our other landmarks? If we can't find our pancreas, what are some other landmarks we can find? Who's he connected to?
Main portal vein.
That's going to be a little bit harder just because it's harder to see, but we can try to find that portal splenic confluence. And who's the portal splenic confluence eventually become? So you can trace that main portal vein back if you need to try to find that pancreatic head. And then we can do our 7 o'clock. We can also look for that SMA in the aorta. Remember how that SMA, aorta, and that left renal is going through? So if I can see SMA and aorta, I know I'm in the right neighborhood to be seeing that pancreas as well. Good luck. Okay, so as far as seeing that gallbladder goes, there's two ways that we can evaluate the gallbladder. So if we think about it, so he's attached with his neck, and it's kind of a pendulum that hangs down, so he can kind of swing any way he wants. And so he's attached to that right portal vein. So what I'll do is I'll come in sag, and then I'll just follow that main portal vein all the way through that liver to that right portal vein and look for that main lobar fissure. The other thing I can do is I can start kind of superior to that portal vein land, dome, hepatics, portal, kidney, and I'll start superior to that portal vein land and then just scan kind of laterally towards the right as I go more inferiorly, and that guy should pop up. That being said, sometimes he's doing crazy wonky things. You guys have probably seen him when you're scanning that dome and there's like a gallbladder sitting there and you're like, what is even going on? So sometimes they can be a little bit wonky, but those are your best bets. So let's start, we're going to start with panc or gallbladder. Panc, okay, so we're going to annotate this transverse panc, or transverse on the body, however it's the length of the organ. Alright, so alright, go ahead and big breath in.
It's just that it's not.
So here we are in the left liver
really
lobe, so we're all the way
her
up,
body, but
aiming towards the thorax. We've got that heart
I
coming into
think
the
that
dome.
Becky's going to be getting
We've got
a
some
good
we've got some hepatics,
video.
we've got some portals coming through.
I'm
and we
just doing it
ended
as a
at
backup
portal
in
line.
case.
Okay.
Thank you, though.
So we see our pancreas somewhere. So here's our portal splenic. So SMA, aorta, IVC. So this is that splenic vein we're not seeing too much of, and I'm in true transverse right now, going into that main portal vein. So we like that 10 o'clock for that main portal vein to open them up. So now I'm just going to rotate to 7 o'clock, and there's my pancreas. And it looks so easy. She's a very easy scan. So we want enough depth. We want enough depth that if we're going to see any peripancreatic fluid collections, she's laying on her back, right? So those are going to collect around the tail. So here's the tail right in here. And then we're a little bit obstructed, and we'll kind of get into how to fix that here in a second. So we have tail, body, neck, head, and a little bit of that nutsack. So this would be a good image maybe for our head, but not so much our tail. go back down to Pancreas. We found that main portal vein. We saw him at 10 o'clock. We're just going to rotate to that 7 o'clock. And we want to make, so we're going to take 2 images. Go ahead, Brady, if you do 2. We're going to take one that has that uncinate head, neck really clean. And since we haven't seen the tail, we're going to take a second image showing that tail clean. Oops, no, all the buttons, all the time. Okay. Go ahead, big breath in and hold it. So notice again that I'm angling through that liver window. If I come down onto her pancreas, see how gassy things get? So you may have to go below the gas and scan up. It doesn't work for her. But ideally, you want to go up on that liver and angle down. There's our 7 o'clock. We've got a nice, I'm just going to retake this because I printed. But we've got some shadowing from the stomach here. So what can I do about that? What should I do? I can position my patient differently. I can have her roll up on her side facing away from me and get that stomach to kind of move out of the way. I can have her try sitting up. Sometimes that works, sometimes it doesn't. Some sonographers, I don't have this kind of free time, will have their patients drink water to kind of fill the stomach with water so it enhances. I don't have that kind of time to do that shit. So what I usually do, go ahead and bring it over. So since our shadow is on this, well, that's actually a little bit better. Since our shadow is on her left side, what I'll end up doing is moving towards her right, angling back towards that left, just to try to encourage that shadowing, that kind of gas shadowing from the stomach to get out of the way. And now I can really delineate that tail. And this is stomach right in here. So don't be afraid to kind of move around a little bit, up, down, left, right, below, above. But those are our transverse pegs. So we're gonna have 2 transverse pegs. One that's really gonna delineate the uncinate head, neck, body, and one that's gonna be body and tail.
How about that dark spot right there that you just pointed at?
That's just edge artifact off the stomach. We can still see the pigtail. We see that we've cleared the border of it. It's just edge artifact off the stomach, which physics happens, right? Okay, so go ahead and bring it over. I didn't tell you to. So for Sag Pank, we're going to get what we call the Pank hamburger. And if we think about anatomically what's going on here, so we've got that main portal vein coming through here, and it's going from the splenic vein this way over to the main portal vein to the liver. Then we have 2 vessels coming in here, the SMV and the IMV. We looked at this in length this way. Now we're going to look at it this direction. So we're going to look at where that SMV, IMV actually plug in. So we're going to see main portal vein across section, and we're going to see that SMV, IMV plugging into it. So we're going to be Sag on the body, and go ahead and be with it. So here, let's look at our aorta. So we have aorta here, so we've got a little bit of pancreas here. So if we go this way, this is at we're at the pigtail, there's a splenic vein going all the way over that spleen, kind of gassed out. We're coming back towards her right side. This is now going to be the portal splenic confluence, and you can see where that SMV and that IMV come right in there. So this is our Pank hamburger. We have a lot of buns in here. So her left is over here, her right is over here. So this is like in her this direction. So spleen over there, liver over here. Portal splenic confluence and cross section, SMV, IMV plugging into it. So it's like a big T. So before we looked at the top of the T, and now we're looking at the side of the T. Does that make sense? She doesn't have a lot of uncinate. Some patients will have a little bit more uncinate right in here. But here's the head. So we've got the top bun is going to be the head. The burger is going to be portal splenic confluence, SMV, IMV coming in. And then not a lot of uncinate, but our bottom bun would be the uncinate. So the Pank hamburger. Any questions on that bad boy?
Can you
The orientation? Yep. Okay. So this is in her body like this. So we've got splenic vein to portal splenic confluence to main portal vein coming into her liver. And we've got SMV, IMV coming in. So up until now, we were looking at this view. We were looking at our portal splenic confluence in length. Now we're going to see our portal splenic confluence in transverse and the SMV, IMV coming in. So we're looking at it from this direction.
And I will know which like X1 or 12.
However it takes to lengthen it out. So go ahead and breath in. So what I do, I find that portal splenic confluence. So if I go in the liver, so here it is crossing the IVC, so I know it's portal vein. And now I'm going back towards her left side, and that will open up, and you'll start to see that SMV, IMV coming in.
We're looking a little bit to spleen.
Not that far over though, because if you look, this is the aorta. So we're kind of just off the side of the aorta. Is that making sense to everybody? Okay. So next up, let's do some CT. Nope, I'm gonna print it for you guys. Okay. So where did this guy live? I wish I knew. Top? What? Top? What is this? Okay, go ahead and print it and hold it. Alright, so we're going to start, we're kind of at dome land, coming into hepatic land, kind of cruising down. Here's our IBC, we're waiting to see that main portal vein open up along that IBC, kind of turning to 10 o'clock. I'm going to put my color on to prove that that's actually common bile duct. So do we see, let me try again. Do we see an anechoic tubular structure with no color flow? We do. So he's right in here.
That looks incredibly easy. It's not that easy. It's usually not even easy for me. She's just a nice scan.
So you'll kind of struggle a little bit. So what we may also see is if we kind of cruise back here in our cine. So see how we have like little kind of blips here? The hepatic artery is draped across that, kind of like ketchup on a hot dog. And so you're going to see little cross sections of it. You just want to make sure when you have it in length, so you can kind of see where he's at right here. Like, see how he's just posterior to that common bile duct? So we want to make sure that we're not evaluating the hepatic artery, but we're actually getting as long of length as we can with that common bile duct. And then who was it that has their gallbladder right there? So you'll probably have a pretty prominent common bile duct. So we're going to take our caliper. Now, how do we measure this? Do you guys remember? Inner to inner. You got it. So I'm going to go to the widest area. So I want to give them kind of worst case scenario. So we're at 2.3 millimeters. Is that normal? 0.2.
Little bit bigger than. Nope.
Or is it 0.5?
So the book says 6 or less, and then at my work we do a millimeter per decade. So like starting at 3. So she could, she could be 15 and still have a 3, but after like at 40 you can have 4, 50 you can have 5. Okay, so you want me to go over that one again because that was pretty quick. So we went down, kind of in our dome land, dome land, cruising down. We went to hepatic land, coming into portal land. There's that main portal vein crossing the IBC. We kind of lengthened that guy out. We threw a color box on to prove that we were looking at. Oh, look at that, by the way. Even better. So we've got it. So here's where it's coming into. So here's pancreas right in here. So uncinate, a little bit of the head. This is oblique. Portal splenic confluence obliquely. And so we've got where this is coming into that posterior aspect of the pancreatic head. We're able to trace it all the way to the common hepatic duct. So hers trumpets a little bit, kind of widens. So I'm going to measure the widest area. I want to give the worst case scenario. This will be a little bit, according to your book, it will be normal, but for my work, because you're not 50 years old. But there we go. So we have it totally elongated. Yeah, if you want to do this, it can't hurt. Okay. For this, because it runs along the main portal vein. So yes, it's portal veins like at 10 o'clock. We're going to be at 10 o'clock. Okay, let's do Sag gallbladder. Oops, oh, space. Okay, let me put this. All right, so finding our gallbladder. Let me get some depth. Just so you guys have a little idea. Okay, put a big breath in. So we know this main portal vein crossing the IBC. We just saw him this way crossing the IBC. And so we're in sagittal. We're just going to keep following him, and eventually it's going to lead us to the main lobar fissure where our gallbladder is. Now the gallbladder, when breathe, it can live in here anyway. So once we find that main lobar fissure, you're going to find the neck of the gallbladder, and then you're going to have to swing around and maybe move laterally or move medially to try to lengthen it out. That just gives us the location, but it doesn't elongate it. So we have to elongate it after that. So we're going to big breath in. So we went to that. So here's aorta. We've got panc here. This is that splenic vein coming this way to go towards the liver. So we have main portal vein over the IBC. We're coming in. Look at this, right portal, MILF, right? And then we're going to come over here and get that gallbladder lengthened out. Quick breathe. One thing that's important to note, kind of like we talked about with the kidneys, if I can use the liver window, I will. So with her gallbladder, what I'm going to do is I'm actually come out laterally and then scan back towards it to see if I can get some liver between my transducer and the gallbladder to clean out the fluid. How you look to Okay, ready, kid, be ready. So IVC, found our MILF. Now I don't have very good liver covering, so I'm going to go all the way out here and scan back. See, I have like a liver window now. See if I can get that a little bit clear. Just got a little squirrely this time. See if we get that a little bit clear. And hers, in this case, where I have the liver window, I can go ahead and breathe. I can get fundus to body really well, or I can get kind of neck to body. So you might have to give me a couple of images if you don't see it very well. She's got a little kink under that ear. So now we're seeing. So we've got right portal here, not really seeing the main lobar fissure very well. Neck in here, we've got a little fold, which is called Hartman's pouch. Hartman's pouch. Hartman?
H.
And then we got our fundus up in here. Not very clean. So if this was my patient out in the real world, I would want an image showing that neck and body really clean, and then a second image showing that body to fundus really clean. So we can clean it out. Now, let's measure this thing. How are we going to measure this thing? What are we going to do? What do we measure? What are we measuring on this bad boy? Nobody knows. So we're going to do the wall, right? Good. Let's get a nice clean wall going. Anterior wall. You got it. So now we're seeing less of that kink, less of the fundus, but we've got a nice wall, clean wall to measure. So we're going to take our calipers. You want to measure the anterior wall. See how thick this posterior wall looks? You remember learning about refraction yesterday? Weird. It's almost like physics is physics and physics. So we always want to measure the anterior wall. Some sonographers will measure it in transverse. I have found that it's easier for me to determine whether I'm in true sag, like if the wall is the thinnest it should be. And in transverse, you can oftentimes kind of be oblique on it, so you make the wall a little bit thicker than it should be versus being true transverse. So I usually do the sag. You'll run into everybody out the whole So we want just one portion of the wall to the other. Now I'm going to go 90 degrees to that wall. I don't want to go 90 degrees to my screen because this wall is angled. So I'm going to go 2 millimeters. What are we thinking? Looking good. Okay, so for transverse gallbladder, we're going to try to get representative images of the neck, body, and the fundus. This gets kind of goofy. So if my gallbladder is like this in my body when I'm looking at sag, it's angled, and I go to transverse, I'm going to be oblique on my transverses. So the angle that I have in sag indicates to me where I need to go in transverse. So in this case, I would need to go superiorly and scan inferiorly to get a true transverse of my gallbladder. Does that make sense? So the angle of the gallbladder, I'm angled this way. If I just move to transverse, I'm going to be oblique on those walls. So I need to come up superiorly to angle inferiorly to make sure that I'm true 90 on that. And I may have to change that angle. So say she's got a gallbladder shaped like this. So I may have to come up here, then I'm good, and then I have to go back and scan the opposite direction for the inferior. So it just kind of depends. The other one that's a real pain in the ass is when you have a gallbladder that's pointed straight up. So I see a gallbladder that's pointed straight up. Sag, transverse. Hey, wait, it's still pointed straight up. So in that case, you actually have to change your scan plane by 90 degrees to get your transverse. So it's not just a matter of going from sag to transverse. You actually have to change your entire scan plane to get that transverse.
Shea, I have a question.
Sure.
When it's straight up, you can still get that sagittal from the anterior.
Yeah, you can get sag. Absolutely.
Yeah, 'cause it's
Perfect. Yeah.
grown.
But then you're going to have to switch 90 degrees to get that true transverse. Okay. So, go ahead, pick up and hold it. So based on the lie of her gallbladder, how am I going to go to get true transverse? You have to come up superiorly, right? And then angle towards the inferior. So we're going to go transverse. I'm going to go away from the neck of that gallbladder. We're going to come back down to towards the transverse. And there it is. Now, priorities.
It is good.
As well as I should.
Yeah, that'd be great.
Okay, quickly. Okay, so we came up. We're not true transverse on her because we went 90 degrees on the gallbladder, so we're a little bit oblique on her. So here's that portal vein coming in. Here's that main lobar fissure. We're going to come into the neck of the gallbladder. I'm going to use as much liver window as I can, so I'm angling through that liver. Just got a little bit of breakfast gone by or something that's gone by. So there's my first image going for YouTube. So there's the neck. And one thing you can do to kind of check your if you're oblique or not is you should have like the same thickness throughout the entire gallbladder wall. You shouldn't have the anterior looking one way and the posterior looking thick, or the whole thing looking thick. It should be a little bit more symmetrical around the whole thing. Now these aren't necessarily round. We like to think of them as nice round structures like the aorta. They kind of take up whatever space is near the, like we saw that bowel is kind of compressing on the side of it, so it's kind of got a little dent in it. Okay, we can't think about it. So we did one for neck. We're going to do another for body. So I'm coming in again. So we're at dome, hepatic gland, coming inferiorly, main portal vein. We're just going to walk down that main portal vein. There's our neck. We're going to cruise down, get somewhere in the body. Now, am I oblique? Are you sure? I think oblique. So look at the wall symmetry. So I'm going to kind of change this. So see how furry this looks? Now, if I just kind of do clockwise, counterclockwise, things are going to look a little bit more. Using as much liver window as I can. Now we've got a little bit more symmetry on our walls. And that was our body. The last one we're going to do the funnest one we're going. And so as much liver window as I can get. So here's our fundus. Let's see if we can walk back a little bit. Go ahead. Liver window in here. Back to sag, make sure we're square. Here's our fundus. How's that feeling for you? How many fingers? So 2 in sag with then the wall measurement, so 3. You can measure one of your sages with the wall measurement. So 2 images, 1 with calipers, so 3 in sag. And then neck, body, fundus, and transverse. And then when you roll, you don't need quite as many. You're just going to need 2 representatives in transverse and 1 in sag. Go ahead and breathe from that if you're not. The other thing too is when we're evaluating this gallbladder and we're looking at it in sag, so I'll get my 1 sag image, and I'm not just going to repeat that same sag image. As I sweep through, sometimes there's polyps on the lateral sides, and they're really difficult to see when I'm just sweeping through. So I need to maybe move even just a centimeter just to sweep the wall a little bit differently to make sure that there wasn't any pathology that was missing just because I was right on those walls. So don't be afraid. So your first sag would be here, second sag would be a little bit over here, and then you'll have one with the wall measurement on that image.
And the reason you know for the neck that you're in the neck transverse is because main lobar fissure.
Yeah, and it's always, so the neck always points towards the portal vein. So whatever part of your gallbladder is close to that portal vein is going to be the one that's the neck. And then we're going to have her roll up onto her side, facing away from us. Do our LLDs. So we'll do sag, gallbladder, LLD. This is one of the few times that we annotate a position change.
Yeah, let me take it.
And this is like a pendulum, right? So we saw it before in one particular spot. And it might move. It might just move. It might be over in the left or below. It might be way over in no man's land. So here we are, IVC. IVC. We've got that portal vein. So we're just going to follow that portal vein. And there it is. Window in. So then there it is out. Linked it out quite a bit, didn't it? We can actually see kind of the more subtlety of the neck where it goes into the cystic duct. So we're seeing a little bit better. So we'll take a representative here, and then we'll take 2 transverse LLDs. Doesn't matter if you're in the fundus or not, I don't care. Just representatives. So we're up in dome land, coming down to that portal vein, cruising around. Gallbladder neck to show up. Then we're in the body. We'll take one in the body. You seen it? And what caught your eye about it when I scanned through? It's kind of a blip, wasn't it? Couldn't be. document, yeah.
Just think possible bone noted.
Well, and it's on the bottom of her gallbladder. We didn't notice it before, so I'd actually, if this was like a real patient, I didn't notice it supine, I noticed it LV, I'd roll her in there and see if it moves or not. Right now, I haven't really disproved it because it's on the bottom. If it was on the side, then I know for sure it's a column. But we'll find out. Maybe a little tiny gallstone in there. We'll find out. Okay, I'm gonna drop this down. Any questions?
Can you see it on this?
No.
I didn't really see what you meant by it.
It's gonna be right here. See how it's in and out?
Yeah, I saw it at first and then I didn't know what you meant by
It's
it.
like ghost.
And do we need to take 3 in LLD for transfer?
I believe your protocol says 2 and 2 transfers and 1 sag in LLD, but double check your protocol. Okay, I'm gonna lower you down so you don't fall off the bed. Knees out of the way, everybody.